My name is Brandon Burk. I am a registered respiratory therapist from Springfield, Missouri. I'm currently the Director of Clinical Education for Respiratory Therapy Program at Ozarks Technical Community College. So the next thing we're going to discuss is setting suction pressure itself. The guideline would suggest that we should use the least amount of suction pressures as possible. And the recommendation is to use less than negative 150 millimeters of mercury in adult patients. The reason why we would want to do that, again, is to prevent that from atelectasis from occurring, or if we were to accidentally get the catheter onto the tracheal wall, it would prevent that tearing of the tracheal mucosa. As a general rule, the suction pressure setting adults should be set between negative 100 and 120, pediatrics should be set between 80 and 100, and neonates should be between 60 and 80. Progressively, as you go down in size and patient population, you should also go down in suction pressure. In my experience, and unfortunately, suction pressure is seldom even a consideration. So frequently when you go in to check the suction pressure on a patient, it'll be set to full wall vacuum or anything in between. That is a problem because what frequently will happen is we generally don't even consider what we're going to be doing to the patient. Part of the reason is because we have patients that have multiple things that need to be used for suction. So they'll have a chest tube, they'll have an NG or OG tube, they'll have a subglottic suction tube, they'll have an endotracheal tube, and they'll also have an oral suction, a Yankauer suction catheter. And frequently, because the Yankauer suction catheter goes into the mouth, what will happen is that those pieces will actually be wide in together. And the main problem with that is that a Yankauer suction catheter can actually be used at full wall suction pressure because it's only made to suction out the mouth. And the mouth has very rigid tissue that can withstand a lot of pressure and a lot of trauma because we're used to eating and chewing in our mouth. However, those are typically wide in on the same canister as the inline suction catheter that we use to suction the airway. And if you use that much pressure, you can cause a lot of damage. So those two should be set at different pressures, and really that practice of putting them on the same canister is not really one that I would recommend because of the potential complications that can occur because they need to be using two different suction pressures. Please contact me anytime with any questions you might have. I'd be happy to hear from you. Thanks.